Hello, my name's Dr. Zara. I'm one of the directors and owners of Tweak Facial Aesthetics. Today I wanted to bring you a video about the importance of seeing a qualified medical professional for your aesthetic treatments. A medical professional includes anybody who's a doctor, dentist or nurse in the UK. Lots of people aren't aware, but aesthetics is largely unregulated in the UK. What that means is it's perfectly legal for the builder outside who's making your fence to go on a 3-day course, get certified and then inject your face. He can say he's a qualified aesthetic practitioner and carry out injectable treatments. Pretty scary. We've seen the likes of reality TV stars such as Lauren Goodger and other social media influencers capitalise on their large fan base and start their own aesthetics business. But these people are not fully trained and qualified in the way that you would want somebody to be if you were having a procedure done to your face. In the UK, the majority of injectable procedures are carried out by non-medics. With what's been happening in the world with coronavirus, now more than ever, it's super important that you go to the right person to have your injectable treatment done. By informing the public, we make sure that we are allowing our patients to make an informed choice about who they trust with their face. We all know that infection control is important, but the current situation has highlighted the implications of infection control. A medical professional has a deep understanding of infection control. We are taught this from an undergraduate level, and it is something that we implement on a daily basis. It's second nature for us to carry out excellent infection control. From zoning to ensuring the correct products are chosen for cleaning and the correct PPE is worn, it's more than just wearing a mask and gloves. Infection control is so important from before you arrive in the clinic to when you're having your treatment done to when you leave and have to have aftercare. Doctors, dentists and nurses will be following evidence-based guidelines set out from governing bodies, providing protocols on how to minimise the risk of spread of infection. These guidelines are constantly changing, and so they will be updated as required. As a medical professional, we would be providing a surgical level of care to reduce the risk of transmission of any infection to our patients and keep our patients safe. Medical professionals are required to be registered with either the GMC, GDC or NMC. This means we basically take an oath to follow the standards set out by the governing body. The primary focus of all of these guidelines is to do no harm and to put the patient's best interests first. A medical professional has a responsibility to you as a patient to put your safety as a primary focus of their treatment plans. A medical professional is used to working with people who have a variety of different medical conditions. We understand the implications of different diseases and medications. What that means is that when we see you for treatments, we are able to assess whether you're a suitable candidate or not. If we don't think that this treatment's in your best interest, or we think that there may be a complication associated with your medical condition, we would advise you not to have the treatment done. As a healthcare professional, we have a responsibility to make sure that our patients are in safe hands when they come and see us. With many friends and colleagues in the industry, we're part of a network of experts in different fields of healthcare. What that means is, if a complication was to arise, we would be able to make sure that you were in the right hands to deal with it. Lots of healthcare professionals are also members of ACE. This group provides expert opinion and protocols on how to manage complications, so that your complication, if it was to arise, would be managed quickly and effectively. A deep understanding of anatomy is super important in aesthetics. We're working with people's faces, which is a 3D network of skin, muscle, fat, bone, blood vessels, all sorts. So we need to know where we're putting our needles. As a dentist, we carry out many years of anatomy training to the head and neck, including cadaver dissection, and many, many exams. Medical professionals are required to do continued professional development, which is basically just learning more and making sure that we're on top of everything that we learn at undergrad level. And many of my colleagues and I are constantly learning to ensure that we try and master our anatomy knowledge. When carrying out injectable treatments without the correct anatomical knowledge, the results can be catastrophic, from permanent disfigurement to vision loss. It's just not worth the risk. Within aesthetics, it's important to select and use the correct products for treatments. Medical professionals have access to a different amount of products on the market for injectables. As a medical professional, we can prescribe products such as neurotoxin, medical grade skincare, antibiotics if you need it after having treatment done, and most importantly, hyalase. Hyalase is an enzyme that dissolves dermal filler in an emergency situation. If there had been a complication and you went to see a practitioner who couldn't prescribe hyalase, what would happen? Non-medical injectors also do not have access to premium fillers through official channels. Brands such as Juvederm, Restylane, Teosil and Bellatero only give access to their products through official channels and pharmacies, for which you have to be a registered medical professional. They may have access to fake or cheap products which do not have the scientific data or research behind them that you would want if you were having something put in your face. I hope this video has given you a deeper understanding into aesthetics and the importance of choosing the correct practitioner for your treatment. It's important to differentiate that these treatments are medical treatments and not the same as having your nails done or your eyelashes done. They require expert knowledge, many years of training and qualifications behind them. So stay safe, see a medical practitioner, protect your face. If you have any questions for us or you'd like to get in touch, please contact us via our Instagram @tweakyourface or go to our website www.tweakyourface.com for more information. Please subscribe to our YouTube channel below. Thanks for listening!